Welcome back to Physio Vibes. In this video we are going to look at
rider's strain and physiotherapy management.
Before we start, hit the subscribe button for more videos. Press the bell icon and never miss another update.
Rider's strain and physiotherapy management. Rider's strain is commonly known as an adductor strain, groin strain and adductor longus injury. The adductor muscles are a group of three thin muscles that run along the inside of the thigh. They are known as adductor magnus, adductor minimus, and adductor brevis. Collectively they are called the groin muscles. These muscles are skeletal muscles. They function to pull your leg inwards. This type of movement is often seen in horse riders and kicking a ball to the side. They also help to balance your body on uneven surfaces and can stabilize your trunk when moving laterally. Rider's strain. Groin strains occur more often in individuals who participate in competitive sports such as football, baseball, karate, tennis and running, typically sprinting. A groin strain is the result of a sudden contraction of the adductor muscles when it is in the elongated/stretched position. If the force going through the muscle is too large, a tear can occur to the muscle fibers, resulting in the muscle strain. Usually adductor longus muscle is prone to injuries like adductor longus strain due to overstretching and overuse. Causes for rider's strain. Sitting cross-legged for prolonged periods of time. Gymnasts and aerobic trainers who teach vertical and horizontal splits with their legs can also strain the adductor longus muscle. Soccer players are also more prone to adductor longus strain due to extensive and forceful kicking the ball. Factors that can predispose a patient to injury include failure to warm up, properly stretch, or fatigue from overuse. Any activities that require quick movements or side-to-side movements can cause adductor longus strain. Signs and symptoms. Pain on running. Swelling/bruising occasional. Weakness in injured leg. Reduced motion of the hip and thigh. Sudden sharp pain on the upper inside of your leg or groin area. Groin discomfort described as pulling sensation. Tender to touch in your groin. Walking may be affected, depends on the severity of strain. Diagnosis. Physical findings include tenderness to palpation touch, bruising over the inner thigh and sometimes swelling and warmth over the site of injury. Range of motion testing of the hip is usually normal, but pain is usually reproduced when the patient is asked to contract the muscles. In this case, asking the patient to bring their leg towards midline adducting their leg reproduces pain and is usually accompanied by weakness. X-rays are almost always negative. MRI is indicated in elite professional athletes, in which precise knowledge of injury location and extent may help in estimating return to activity. Treatment. Adductor muscle strains respond to conservative treatment. Initial treatment includes activity modification, which may temporarily include crutches. Ice and anti-inflammatory medication are appropriate for acute muscle strains. As symptoms improve, gentle stretching and strengthening exercises are appropriate. Surgery for these injuries is rarely necessary. Avulsion injuries, in which the tendon is pulled away with its bony attachment. Some cases of complete muscle tendon tears may require surgery. Surgery is also necessary in patients with chronic pain whose symptoms do not respond to conservative treatment. Physiotherapy measures for groin strain. Rest is the most important part of treatment for adductor strain. There should be no stretching activities performed initially for few days. Apply ice rest, ice, compression, elevation, which will relieve pain and reduce swelling. Place the ice bag wrapped in a towel over your groin area. Ice therapy for groin strain. Icing the region helps in relieving pain and swelling for 20-30 minutes, every 3 to 4 hours for 2-3 days. Heat therapy hot packs gives immediate pain relief, helps to relieve muscle spasm, improve blood circulation. Ultrasound used to relieve pain and promote healing. Care must be taken not to stretch too soon, as healing could be delayed. Thigh and groin wrap. This wrap comes in the form of a gel pack which is adjustable and gives you proper fit and compresses the adductor longus muscle to allow it to heal. Compression shorts. These types of shorts also compress the adductor muscles and facilitate early healing of the strained muscle. It also helps in reducing swelling. Massage therapy. Superficial massage therapy is advised during first 3 to 4 weeks when groin strain results from muscle trauma or tear. Deep massage is essential when muscle injury is healed and groin pain is mostly caused by scar tissue during muscle contraction. Exercises for groin strain. Exercises can be started once the patient is pain-free. Stretching and strengthening exercises can be performed to improve and regain full function of the groin muscles.
Thanks for watching. Don't forget like, share and subscribe.